I do think as somebody who has been turned away from donating blood, it's very frustrating. I actually cried afterwards because it just like bubbled up so much anger and resentment.
From personal experience, when I went to donate blood as a college student, I didn't know that was the case. And when I got there, they're like, oh, you cannot donate blood. I mean, you feel embarrassed, you feel, shocked, and you don't really understand what is going on. And that's been, replicated in many of my social networks, my friends, and also my patients.
On May 11, 2023, the U.S. Food and Drug Administration announced new guidelines that would eliminate blood donation policies that are based on sexual orientation. These new FDA guidelines and a 4-decade-old policy that previously barred gay and bisexual men from donating blood. The new individual donor assessment will now ask all prospective donors about new or multiple sexual partners in the past 3 months. Prospective donors who report having a new sexual partner or more than one sexual partner and had anal sex in the past 3 months would be deferred from donation. A prospective donor who does not report having new or multiple sexual partners and anal sex in the past 3 months may be eligible to donate. To learn more about the FDA's new guidelines and the history of the blood ban, JAMA spoke with Dr. Anu Hazra of the University of Chicago Medicine and Howard Brown Health.
Yeah, so the FDA blood ban of banning sort of any blood from gay men or men who have sex with men really was born out of the AIDS panic of the 1980s when the U.S. blood supply did not have proper adequate screening mechanisms to screen for HIV. And since then, the law really sort of stayed around for nearly 40 years, really thinking that this one population is seen as a monolith and they all have the same acquisition risk of HIV and therefore they should be banned from blood. Even after we had effective ways of screening blood supply and our blood banks were able to screen their supply for HIV and other sort of bloodborne pathogens very effectively, people were really reticent to change what was a long-standing sort of dogma that we should just ban a whole group of people from donating their blood. And this wasn't really challenged throughout the 90s for this reason.
The initial FDA lifetime ban against blood donations from gay and bisexual men began in 1983. In 2015, the lifetime ban was replaced with a new policy that would allow gay and bisexual men to donate blood, but only if they had not had sexual contact with another man for at least 12 months. Another revision came in April 2020, with the FDA reducing the 1-year time frame down to 3 months. This 2020 revision came during the height of the COVID pandemic, when the country's blood supply was depleted due to nationwide shelter-in-place orders. Still being barred from donating, Dr. Greg Zahner of Massachusetts General Hospital published a JAMA Internal Medicine article sharing his frustration with the then new 3-month deferral period, a policy update that he called an excessive and needless buffer for gay and bisexual men to donate.
And then the news came across the FDA had changed their restriction from a 12-month deferral to a 3-month. And while that sounds like progress, that really ticked me off because in 5 years, the data had not changed. There wasn't new evidence. All that proved to me was that the 12-month deferral period was wrongly decided in the beginning. It was way too excessive, and that now is being shortened to 3 months purely out of, need because there just was not enough blood.
Beginning in 2020, the US FDA funded the ADVANCE study. In 8 cities across the United States, this study was conducted by 3 of the nation's largest blood centers, with assistance from LGBTQ+ organizations and other partners. The ADVANCE study investigated if a screening questionnaire based on individual behaviors can identify donors with lower HIV risk. The study enrolled 1,566 sexually active men who have sex with men. All enrolled participants were assigned male sex at birth. 1,562 participants did not have HIV. Just over 50% were not taking PrEP, a medication that helps prevent HIV. Individuals who use PrEP are ineligible to donate blood due to the possibility of a false negative HIV test result. Of those not taking PrEP, in the last 3 months, 66% reported only one sexual partner or no anal sex. 69% reported no new sexual partners or no anal sex with a new partner in the past 3 months. The study also found that nearly a quarter of enrolled study participants would be potentially eligible blood donors, using individual risk assessment questions. In addition to the advanced study, the FDA also looked at data from other countries that had moved to similar individual risk assessment questions. We asked Dr. Zahner, what does the new individual donor assessment mean for the LGBTQ+ community moving forward?
The amount of change that has happened in the last 8 years is something I think we can be very proud of as a society. There's been so many people involved in this. I mean, I have had no role. I am just somebody who got really frustrated and wrote something about it that was deeply personal, but an experience that, tens of thousands, hundreds of thousands of others have experienced over the years with being turned away from donating blood. Everybody who was involved in the advanced study, they all deserve a lot of credit for making this happen. And progress, particularly when it comes to regulations around our health and wellness, can come really slowly. But I think a lot has happened in the last 8 years that we can be really proud of.
Having a patient come in who is asking, can I donate blood now based on this change? I would say wholeheartedly yes. I mean, if you are able to fill out this individual risk assessment and whatnot and feel empowered to donate blood, you 100% should have that opportunity to do so. And even small wins like this are not that small to that person. That it is I think a major change to them that they're able to, feel like they can, contribute to society in some way and really help someone else in need.